I'm going to be talking about why I think we should adopt a single-payer healthcare system in America. I will begin by giving a little current background on how healthcare works in America right now. Citizens are responsible for buying their own health insurance, and the cost of health insurance is very expensive. In 2017, the average cost per individual was around $393 a month. This was a 22% increase from 2016. The family average cost monthly was $1,021, and that was a 23% increase from 2016, which was $833 a month. The result of the expense of health insurance is many people left with little or no form of health insurance coverage. On average, 45,000 deaths a year are related to lack of health care coverage. Additionally, 27 million Americans will remain uninsured or underinsured by 2025 with our current healthcare system. Single-payer healthcare in America would mean coverage for all citizens. This would be financed by a small increase in taxes, and it would be run by the government. Through my research on this option for healthcare, I have concluded that the three most powerful claims in favor of the single-payer system is its affordability, its accessibility, and its quality. In relation to its affordability, healthcare would be financed through a small increase in taxes. The estimated increase would be 2% in federal tax and 7% in payroll tax. The 2% increase in federal would be less than the majority of Americans pay out of pocket for coverage. The 7% increase in payroll tax would be less than most employers pay for the healthcare coverage of their workers. Also relevant to the affordability, hospitals and drug companies now spend billions of dollars on promoting their services and products. If one system, like the single-payer system, covered all Americans, that money could be spent on disease prevention and research rather than advertising. Because of the single-payer system's affordability, businesses would be relieved of the financial pressures of providing employees with health insurance, and employees wouldn't be confined to a job simply for its health coverage benefit. The single-payer healthcare system would provide high-quality coverage because the quality of care must be acceptable for all citizens. The single-payer system aims its funds towards interventions that will, in the long run, save the most lives. Under the single-payer system, there would be no worry of intrusion on the doctor-patient relationship. This would advance the ability to monitor healthcare quality. In addition to these, single-payer facilitates real healthcare planning, and it assures resources are there when needed and not duplicated when an excess will inflate costs. The single-payer system makes healthcare easily accessible. I'll use Taiwan as an example. After adopting the single-payer system, 99.9% of Taiwan citizens are insured and can choose their physician. Everyone in America would have health care coverage with a single-payer system, despite income, race, age, condition, employer, or gender. Although the three claims I've just explained in favor of the single-payer system are powerful, the heart of my argument is that I believe health care should be a right. With the various costs we as Americans pay to live, and at that, live comfortably, and the different hardships life throws at us, everyone should be provided with health care coverage. Human life is invaluable, and no health care expense should alter anyone's opportunity to be treated. Envision the constant stress that you or someone in your family may require medical attention, although you can't afford it. America has long claimed to provide equal opportunity for all its citizens. However, here's a question to think on. Does a child born into poverty, whose family cannot afford health care coverage, really have the same opportunity at life as opposed to a child whose family can afford health care coverage? For health care to become a right to all, we must end the private insurance company domination of health care and move towards the publicly funded single-payer system, which provides an equal opportunity at quality health care for all citizens.
Thank you, Mr. Speaker. Mr. Speaker, the health care system in America is disintegrating. 80 million Americans either have no health insurance or are only partially insured. And yet, despite that, the fact that we are the only major industrialized country on earth without universal, comprehensive health care, we spend far, far more per capita than any other nation. Mr. Speaker, our system is not in need of Band-Aids or patchwork or such concepts as managed competition. We are in need of a new system, which is why I am delighted to be co-sponsoring with 52 other members of this House H.R. 1200, a single-payer national health care system which finally will guarantee comprehensive health care to all Americans without out-of-pocket expense. Mr. Speaker, it is only the single-payer concept which can save us tens of billions of dollars by standing up to the waste and inefficiency in the insurance industry, the greed of the pharmaceutical companies, and the excessive income that certain groups of doctors are earning. Mr. Speaker, the American people believe that health care must be a right of all citizens and not just the privilege of the wealthy. Let us pass H.R. 1200, the single-payer, universal, comprehensive health care system.
The gentleman's time has expired.